So this, I'm delighted to welcome Julie Weeks and Tracey Garbarino, who hopefully are out there somewhere, and you can put your cameras on. So they're both primary care knowledge specialists, and they are from Health Education England. So without further ado, I'm going to be quiet and pass on to them. Hi, Tracey.
Hello, hi. I hope you can hear me, yeah?
Yeah, we can hear you and we can see the slides on the screen.
Brilliant. I do have my video on, but it doesn't show me that it's actually viewing, so I'm hoping you can see me as well.
Yeah, we can see you too.
Perfect. Okay, so just a quick introduction. My name's Tracey Garbarino. I've worked in libraries for many, many years, predominantly in schools here in Carlisle and in Vietnam. And I started working in health libraries last year. I'll just hand you over to my colleague Julie for a quick introduction.
Yeah, hi, my name's Julie. I'm based at Hexham General Hospital, and I've worked in public libraries over the years, and I've worked for Northumbria Healthcare for 13 years, and I'm seconded to this role for 2.5 days a week.
So this short presentation will just provide you with an overview of our new roles as knowledge specialists for primary care staff across the North East and North Cumbria. So if we could move to the next slide, please. And the project, so there are around 180 local NHS knowledge and library service teams in the UK, and most of those are based in hospitals. In 2021, 16 NHS trusts were successful in securing Health Education England funding to provide a primary care knowledge specialist. And the role in the North East and North Cumbria is facilitated by Julie and myself, with the ambition to establish knowledge specialists as an integral part of the primary care training hubs and the integrated care systems. This initiative is designed to drive forward the principles outlined in the Knowledge for Healthcare strategy to enable all NHS staff to benefit equally from high quality library services, optimising the expertise of knowledge service teams, which will inform decision making in acute and primary care. The next slide, please.
So primary care is a complex landscape, and awareness of the role of library and knowledge services is limited due to staffing levels and the rural dispersed nature of primary care services. NHS library staff have struggled in the past to find capacity to develop a more targeted approach within the primary care community. However, 6 months into the knowledge specialist role, we're developing relationships with a wide range of users, from research bodies to dentists and pharmacists. Library resources for primary care staff are predominantly electronic, accessed by Athens authentication from the NHS Knowledge and Library Hub. The core content is funded by Health Education England, providing access to healthcare databases, e-books, journals and clinical decision-making tools. Next slide, please. So the region we cover. So our role provides the knowledge and library services for the primary care workforce across a broad geographical region, as you can see from the map on the slide. The North East and North Cumbria integrated care system will be established in July, covering 66 primary care networks and 356 practices, caring for around 3 million people. Next slide, please.
So the training hubs themselves, every primary care network has access to the primary care training hub, and it's seen as the go-to place for information about primary care workforce, education and development, addressing local needs and health inequalities. We've embedded our knowledge and library services website within the primary care training hub, and we aim to ensure that all healthcare staff have equitable access to the evidence base to inform their decisions and practice, and to build a strong learning and improvement culture across the region. And the final slide, please.
So that was a brief overview of our role, and we're happy to take any questions, or you can contact us with your inquiries at a later date.
Thank you very much. Brilliant. That was completely to time.
That's surprising.
It's like, oh wow. I get very obsessed with time when I'm doing something like this. So I'm just looking in the questions to see if we have any questions from anybody. I think you've been most informative and told us everything we need to know. So probably we haven't got any additional questions. Is there anything out there, anybody? If you have a question, would you like to pop it in the chat now? We'll give people a few seconds just to see if there's anything. So this is, oh, here we are, right. Thank you, Joanne. So how are you going to promote this service? She's asking.
So I could jump in there. We have a web page embedded in the primary care training hub, which is predominantly their online links to their online service. We have a Twitter account. We have been meeting with the local teams across the Northeast and North Cumbria, and from there they have shared our information and our service in different ways. In North Cumbria, our service, we gave them a little overview of what we can offer, and that was shared in their monthly bulletin to all GPs and primary care networks. But we're also doing things like this, which is great. I'm doing a workshop presentation tomorrow for people involved across the CCG, the primary care networks across North Cumbria. And Julie, as she said, went out to visit some dentists, which is great. The pharmacists that we saw were the pharmacy leads across the region. And from there, we've had another invite to go to a specific team. So it's very much trial and error and word of mouth, as we know, works a lot, works very well in this region. I don't know if Julie wants to add anything else.
Well, yeah, I was just going to say that the primary care training hub management have been very supportive in directing us to other connections, really, to promote the service.
Okay, that's great. And I'm just going to ask one other question, which, well, I might get to him, but I'll try this one because this is quite interesting. So is it only for health professionals, or is it for external users as well?
Mm-hmm.
So it's, do you want me to do that one, Tracy? So
go ahead, yeah.
Anybody who is employed in a healthcare setting, whether that's primary or community care, and they would need to join our regional Athens organisation. And that would be anybody also from commissioning groups, so anybody that had an nhs.net email address could join the regional service. There are 16 knowledge specialists nationwide, so if they're not within our region, we can signpost to other services.
Okay, thank you. And one more minute, there was another one, I think from Sinead here. So did you find any difficulties embedding the website to the training hub? Did you go through, must be Health Education England or your IT department? You've got 1 minute.
Okay, I can go there. We found a lot of support to start the project off from Health Education England Training Hub leads, and they put us in touch with one of their admin staff who maintains their own web pages. So we put together all the information we wanted, and she did it all for us. It was wonderful. We get back in touch with her with any updates. So it's nothing to do with our trust. It's all via Health Education England, and they've been really, really supportive. So we're very grateful for their help.
Okay, thank you very much. That's great. Well, thank you. That was really interesting.